Hey Wazukuru, welcome back to Mbia Nyamkuta Glass Table Talk. I'm Connie.
Tari here.
We are continuing with our series on things to look out for on your baby and any signs of abnormalities that should be escalated to the healthcare professionals. So in the last segment, we talked about the abdomen and what things to look out for, amongst other things. So we are going down with our baby. Now let's talk about the genitalia. Do you want to start on that one, Auntie Sari?
Okay. So I'll talk about the girl.
Yeah,
the girl child, the baby girl. So it's normal for a baby to have like what we call pseudo menses. A baby can have like a period, like it's all hormonal activity. It's very normal because it's just the hormones of pregnancy which would have been transferred to the baby. So that's normal, but that should go away, obviously. So just keep an eye on it. If you're worried, take the baby, kutano no examine, but although it's nothing to worry about, but it's just worrisome if you see your baby having something like bloody discharge coming from their genitalia, you would be worried. So if you're worried, take them to the clinic, take them to your nearest health center so that they will be examined to see what goes on. And then there's a discharge that the baby will be having. It's also normal. And also bear in mind that the baby's genitalia is not fully formed. So there are things that are bigger than the other things. It looks a bit abnormal if you look at it. So if you see as the baby grows, it will be slowly formed and it will look normal. So there's nothing to worry about.
Pane vamwe vana vanogona kuzvarwa vaine ambiguous genitalia okuti midwife nemadoctors vanokuudzai if it's presenting like that. Pavana vakadaro ivavo, they'll then have to do mafurther tests ekudetermina kuti majinzi emwana uyu ndeechikomana kana kuti ndeechisikana. However, zvinhu zvausina kukumbira iwewe hakusi kuroyiwa zvinhu. Remember pamavidhiyo edu ekudhara patakataura about chromosomes, it's a recipe just gone wrong, which you haven't got control over. That's the beauty and wonder of science, which is sometimes, just like anything in life, ngokurasisa. Mwana anongo need a love just like anyone else. And mwana ende wako, you don't have to spread it to the whole village who will start giving opinions and sometimes make you not bond with your child because there is all these theories around them. Anyway, I digress because I digress a lot of times. But let's talk about the baby boy. The baby boy, I remember I did put a topic about leave the PP alone. It doesn't need to be opened. It needs to be left alone. Eventually, like Tari said, with time, things just align, things just happen. Usually by the age of 6, that PP would have been open. One thing you should ask yourself though is, why am I opening a child's PP? That we know the time they are going to need to open it. And it's a long time coming. So what's the rush for? That tradition of kudonedzera mukaka, kudonedzera kugeza nesipo, that's what will introduce infection. That's how the baby end up akuzoita infection paka pipi kako, which will necessitate kuzonovhura pipi yoyo and everything. So the best thing is, if you leave things be, you find that you don't run into problems. But I don't know where as Africans, where we've got this notion that we have to rush things. What are we rushing a baby for? Nature will take care of its own. If by the age of 10, 12, that PP hasn't opened, of which by that age, you as a mother, you won't be looking at that. Ask the dad to have that talk with the child and see what's happening. But in immediate infancy, especially in the first year, second year, third year, just leave it alone. As long as there is a good stream of urine, if you find your baby peeing in your face, that baby is peeing fine. The waterworks is working fine. So that's one good sign. If they are peeing in their own face, which means they are making a nice arc, or they are peeing in your face, their waterworks is working fine. Then we go down to the testicles. As midwives and doctors, we check to see if the testicles are in the scrotum. that reassures us if they are in the scrotum. If sometimes there is one, sometimes there is both of them are not descended. When both of them are not descended, we leave it until up to about 6 weeks when the baby has another check to see if the testes have descended. If they haven't descended by that time, the GP will make referrals to the pediatric teams to get this baby further investigated. And sometimes even paternity checkup, if you follow the inguinal canal, you can feel that the testicles are in the inguinal canal, they are making their way down. And we don't worry that much. What we are looking out for is if those testicles are not descended, they are not at the right temperature. Saka arikuramba ari kudenga kusina right temperature, zvinozokanganisa fertility maybe later in life if those testicles don't come down into the scrotum, because as you know, they hang out for a good reason. Because the body temperature is too much for the testicles, later in life, zvinokanganisa the production of good sperm for fertility. So if you see that mwana is getting to 6 months, a year, and the testicles are still not descended, you really need to take that seriously. Take that baby to the doctors. And kufila wachoka, it's not, you shouldn't do it very hard. Men, boys, balls are sensitive. You need to handle them with care, just like you handle men, if the way they want to be handled anyway. Handle them with care, uchinyatsoфila zvakanaka zviri gentle. And explain to your other half, because some people might think you're abusing the child. Explain why you're doing that and show them this video if necessary, because that really needs a good follow-up. It regimented, because unofanirwa kuitwa by a certain age, because mwana akazosvika kuma 3, 4, 5 years matestis waya asina kudescenda zvatofarana. Going back to, if one testicle is descended, there is a good chance that child can father a child. But one racho iro risina kudescenda iro rinofanirwa kuinvestigate kuti riri kupi, because if it's not investigated kuti riri kupi, zvinozokonzera what you call testicular torsion, yekuti tutambo twete tunosungana and cause mwana some pain. So unofanirwa kuinvestigate, because sometimes they have to take it out. But with one, a child can father children. Many children, like Father Abraham. Over to you, Tari.
Right. Just thought of when I spoke about abdominal distension, I also wanted to, I forgot to mention that it could be that the baby hasn't passed the poo. The reason why baby might have not passed poo is maybe because the anus is not open. There's what we call imperforate anus, right? The opening of the anus will be like fused. It happens. But again, it can be corrected. They will do investigations to see if everything in the digestive system up to the anus is okay. And then maybe they might need to do a surgical procedure to open that anus. So always check. But usually we don't discharge a baby from hospital until they pass the first poo. But things can happen. Things can be missed.
Exactly. Tiri panyaya iyoyo nyaya wee and poo in both boys and girls. I did mention before that poo should be changing color. Nappies should be getting heavier as more milk comes in. The first 24 to 48 hours, because we know for breastfed babies, they haven't got that volume. Mkaka usati wanyatouya. So we don't expect heavy nappies, but there should be some urine. And as you get to day 3, day 4, the nappies should be getting heavier, and you should be changing the nappies more regularly. So it's something that you should really look out for in both babies. And if you feel kuti mwana asikunyatsoфida zvakanaka, chidya nekumwa zvakanaka iwe amai, so that unoproduce mukaka, and hausi stressed, because stress chaiyo can stop the production of can inhibit the production of milk. And kana kuti hauna kuluza ropa rakawanda futi kana wakaluza ropa rakawanda, because mukaka unoproducwa kubva mucirculation yedu, hauna kuluza ropa rakawanda stereki. Don't let the baby starve. If you've got access to formula in that time yaunenge uchimirira mukaka, mwana ngaafidwe. Don't go straight to porridge, mwana ngaafidwe nemukaka. at least. Okay, we'll catch you in the next segment when we talk about the hips up to the foot.
See you in the next segment.
Thank you.